Very good. You may take your seat. Dr. Barasa, welcome to this session of vetting your suitability to hold office to which the President has nominated you. This is a committee of Parliament discharging its responsibility under the Constitution and the law. Yours truly here is the Speaker of the National Assembly and the Chairman of this committee. With me on my right is the distinguished Deputy Speaker of the National Assembly, Honorable Gladys Boss. On my left is the Clerk to the National Assembly, and I'll invite all members to introduce themselves.
Chamani Shongo.
Junet Mohammed.
Nelson Koech.
I'm David Kosing, MP, Poko South.
Gikaria David.
Mary.
Mary Emase.
Abdul Rahim Dawood.
I'm Ferdinand Kevin Wanyonyi.
Owen Bayer.
Robert Mbui.
Stephen Mule.
Didoraso.
Abdi Shurie.
Mishimboko.
Caleb Amisi.
Excellent. Dr. Barasa, we'll start by inviting you to make a brief introduction of yourself in not more than 5 minutes, telling us your name, your educational background, your work experience, and any key competences that you have that you think is suitable for your appointment as a cabinet secretary. Go ahead.
Honorable Chair, honorable members, I'd like to take this opportunity to appreciate His Excellency the President, as well as the nominated committee, to give me this opportunity to present myself as the nominated Cabinet Secretary for the Ministry of Health. Thank you so much for your invitation and consideration.
That is your name, your education background, work experience.
I am Dr. Debra Mlongo Barasa. I am a qualified medical doctor. I have more than 18 years medical expertise and public health professional background. I'd like also to say that I am a wife, a mother, and has 4 lovely children. I'm also a twin. So I have a vast experience in terms of policy advice, strategic direction, technical advice, and clinical practice. I have worked in the public sector as well as the private sector. I have worked from the primary care level, the community health programs, up to national level at the Kenyatta national level. I have also worked with the national technical working groups within the ministry. Equally, I have served with multiple Ministry of Health focal points within the Eastern Southern Africa region. They are 22 countries in number, as well as the 47 WHO Afro member states, supporting them in strengthening their IPC or infection prevention and control programs. I have also been a participant in global strategies, global action plans, and also in the development of guidelines at a global level. In WHO, I worked for more than 4 years supporting various member states in strengthening their infection prevention and control programs. I supported them in matters policy advising, in strategic direction, and in technical advice. Implementing activities including development of guidelines, facility assessment, among others. My key achievements in the span of my medical practice include the strengthening of programs. At the beginning of COVID-19, we had only 4 programs within our ISA, 4 countries with infection prevention and control programs within the Eastern Southern Africa region. And at this time, I'm proud to say that we have 22 countries within the Afro region which have strengthened their infection prevention and control programs. So I supported in matters of development of their strategic, their national action plans, and also in developing guidelines, facility assessment, monitoring and evaluation framework, among others. Equally, I supported in emergency response, in emergency preparedness, readiness, and response pillar.
That will do. I will now invite the Deputy Speaker to be the first to ask you a question. When questions are asked, we expect precise and concise answers. Deputy Speaker.
Dr. Barasa, as you're aware, the health financing strategy of 2020 to 2030 notes that the Kenya's health financing is inadequate, incomplete, and inconsistent, and poses a challenge to the establishment of a universal health coverage. And now, with the shift from NHIF to SHIF, the effectiveness of the transition is being debated by Kenyans. So, what are the primary gaps and challenges that you perceive in the implementation, and what should you do to address them if confirmed as Minister of Health?
Dr. Barasa, can you answer that?
Thank you, Honorable Deputy Speaker, for the question. For the primary gaps and challenges, my approach is a consultative approach. I believe that it is critical that we bring all stakeholders together. The Director General, as well, the PSS, the National Technical Working Group, stakeholders, as well as other sectors, including Treasury. We also need to involve the community. It is imperative that the community is informed and that they are aware and they own the SHI. Without the community owning it, implementation will be difficult. And so we need to strengthen communication, receive feedback, and analyze. In the consultative process, we need to conduct a situational analysis to see the strengths, the weaknesses, opportunities, and threats for the implementation of the SHI, and come up with priority actions to intervene and support in a seamless way. So, as I said earlier, community ownership is critical. Equally, we need to strengthen the operations and the logistics. If we don't have enough financing for the SHI, then the implementation will not be seamless. Equally, we need to address the logistics challenges that may arise during that. One of the challenges that I have seen Kenyans talking about is the Linda Mama. And before coming even before you, honorable members, it was raised to me. And I believe that it is critical that we have a transition plan or a transition guideline to ensure that our mothers and our children can access care even during the transition process.
Thank you. Majority Leader.
Thank you, Honorable Speaker. CS nominee Debra, I see you have very good experience from your professional background and having worked in the private sector in healthcare. And one of the issues that probably might have come to your attention is the ills that bedeviled the defunct NHIF. And the move by government, and I'm certain you may have taken keen interest on the Social Health Insurance Fund and the challenges that are there now with the Social Health Insurance Fund. One of the problems that we've had with the NHIF is collusion between staff at NHIF and private medical care providers, unfortunately including faith-based ones. And we have seen exposés in the media of very small private hospitals raking in millions, hundreds of millions from NHIF. I would want to hear what, having looked at SHIF, which I'm certain you must have looked into, what are the measures you intend to put in place should you be approved? One, to curb the theft that has been witnessed in NHIF by both the public and private medical practitioners, especially owners of private hospitals. Two, how do you intend to leverage on technology to ensure, one, that you bring down the cost of healthcare in this country? There are hospitals that will charge NHIF 200 shillings for paracetamol. There are others within the same vicinity that will charge the same fund 30 to 50 shillings. How do you intend to utilize technology to curb some of those things?
You may proceed to answer.
Thank you, Honorable Member, for raising the concerns, and indeed I understand and have interacted with various Kenyans that have raised the very same concern. First of all, my approach is a consultative approach involving the multiple stakeholders, from the PSS, Director General, the National Technical Working Groups, the NHIF, among others, including the community who working in various organizations. I have seen the strength of having processes and procedures, of which I believe the government has, and we need to strengthen this. One of the ways is using a digital platform that will reduce the human-to-human interaction and will be able to monitor challenges. And this needs to be implemented first on a phased approach, but ultimately at a national level. And that way, we'll be able to monitor various services that have been given. We'll be able to monitor the quality. We'll also monitor the prices, the stockouts, etc. So I believe it's critical that we embrace the digital platform as Kenyans. Again, transparency and accountability frameworks are critical. So we need to look into this, and I believe that the National Technical Working Group is really competent, having interacted with them in the WHO environment, and I think we can work together with the multi-sectoral approach to ensure that we have transparency and accountability, open tenders, among others. We may also consider using external bodies to monitor and ensure that we have no challenges in that. And leveraging on technologies, I believe it's time that Kenyans embrace telemedicine and also embrace the digital platform as discussed earlier.
Junet?
Thank you, Chairman. Chairman, my question to Dr. Debra is, Madam Nominee, as you are aware, health is majorly a devolved function. Health matters happen at the county level. But the problem this country has encountered for the last 10 years or so, since the new constitution and that devolved health functions, is because there is no seamless working system between the national government and the county government. It is devolved, but you'll see a lot of things are happening at the national level. All the complaints are at the national level. And these things are supposed to be at the devolved, because the dispensary at the village there is what matters. So how do you intend to make sure that health is really devolved and resources are taken to devolved units so that people can get the services at in the road there, I mean at the village there? And my last question is, you can see health the number of medical students also are increasing. And the number is becoming big. There are more health workers that are being trained, even as doctors. But the institutions that are training them now are becoming deplorable, in very bad state. Do you think that will compromise the quality of healthcare or the quality of services Kenyans get? Thank you very much.
You may proceed to answer.
Through you, Honorable Chair, I would like to respond to the Honorable Member regarding the health, the devolved government. So again, a consultative approach. I believe we need to involve the national team as well as the county government to have open dialogue and come up with interventions. We need to look at the situational analysis and see where are the strengths, the weaknesses, opportunities, and threats. And from there, we need to come up with priority interventions. So I'm coming out of the government, but I believe having open dialogue, having consultations, and coming up to ensure we understand where the national team stops and where does the county begin. Another thing that will ensure seamless flow of information and also to ensure monitoring from national level, county level, down to facility level is the health information system, a digital platform, so that the reporting system is picked up and goes to the national level and also trickles down to the facility, as well as tracking and monitoring of infectious diseases, quality of services, and also addressing the matters of corruption. So again, it will be critical for us to embrace the digital platform in this case. Regarding the medical students, what I would say is the health workforce is a critical pillar in health systems. All our health workers are important. The doctors, the nurses, lab technicians, physiotherapists, nutritionists, among other cadres. And let's not forget the morticians and the cleaners who are frequently forgotten. And I think it's critical to say that during COVID-19, we saw that these cadres were actually disproportionately affected by COVID-19 and even other infections like tuberculosis and Ebola. And so we need to strengthen our health workforce. With the numbers increasing, I believe, again, it's a consultative effort. We need to bring unions on board. We need to bring professionals on board, the doctors on board, and come up with strategies and areas of improvement. We also need to strengthen our regulatory system to ensure that we are bringing out doctors and other health workers or professions who are qualified, because we are also thinking of these doctors or nurses and other professions working outside Kenya. So we need to ensure that we are providing quality, top-notch quality and highly experienced health workers that are able or capable to work in in other international spaces.
Thank you, Chairman. Dr. Debra, my question is that the instances where doctors have been going on strike have risen, with the recent one being the interns in July 2024. And we know what that means, especially to the Kenyan populace. I'd just like to know how, moving forward, you'd like to resolve this issue, looking at the root causes so that it doesn't recur. And also we have the community health promoters, where they're also saying that the stipend delays, it is low. How do we just ensure that people who work in the health sector, because it's a very important sector, are taken care of in terms of their remuneration and also their welfare? The last question to you is that whether you understand the magnitude of the ministry that you will be leading. You have very critical departments and areas. We have KEMSA, you have the malaria control, you have the AIDS Council, you have the ministry itself, you have a chief, you have all that. How will you ensure, or what leadership skills will you use to ensure that the policies that you put in place, you implement, cascades to all those departments, and not, because we see in health department and also some of the big departments in this country where a CS just wakes up one morning and start issuing different directives, right, left, and center. I would like to know what leadership skills you will use to ensure that does not happen.
Go ahead and answer.
Through you, Honorable Chair, and thank you, Honorable Member, for the questions. So indeed, the doctors' strike has been a challenge over time in immemorial, and every cabinet secretary has dealt with that challenge. And so there's need to look for long-term solutions. I believe that the long-term solutions are with us. So we need to work together with the unions, the doctors themselves, the interns. We need to work with the bodies, the Ministry of Education, among other stakeholders, to come up with a solution. I don't have a solution, but what I am saying is we need to have a situational analysis and be able to develop action plans following that. There is a Doctors Interns Act that I believe is ongoing, and I think that is one of the areas we can start with and strengthen. Equally, there are the return to work formulas that were given to the doctors, of which we can implement with support from Treasury and other sectors. Regarding the multiple departments, I would want to run the office with high integrity. I have seen that we have wonderful national technical leads in the office. We have DG, we have the PSS. I believe by having weekly meetings and sharing reports, conducting monitoring and evaluation routinely, we can be able to strengthen this. But we need to align it with the national strategy and the MTP plan, identify the priority activities, the timeline, and the budget. And if the Treasury is able to provide the budget, then we can implement. And also based on outbreaks that are at hand. As you are aware, there's a monkeypox outbreak, and also we need to ensure that we are prepared and ready to respond to such outbreaks.
Nelson.
Thank you, Honorable Speaker. Daktari, universal healthcare was a key pillar of Kenya Kwanza manifesto. Given the recent High Court suspension of the Social Health Insurance Act 2023 and the Digital Act 2023 due to what they call insufficient public participation, what will be your strategy to ensure that the public is adequately informed and engaged in key decisions that pertain to their health welfare? How will you then increase public awareness about the benefits and procedures of National Insurance Scheme to encourage greater participation and understanding amongst Kenyans?
Through you, Honorable Chair, thank you, Honorable Member, for the question. Indeed, I'm a believer of accessible, affordable, quality of care to all Kenyans, including the orphaned, the vulnerable, the needy in our community, the widows, among others. So I believe that we need to embrace a universal health coverage. Right from the community level, with the community health promoters, I have worked in the Eastlands, and I have seen the critical role they play in terms of bringing health back to the community. I have seen the importance of the primary care level. There is an article we published in WHO. I was part of the team that looked, and we realized that the primary care networks are weak and they need to be strengthened, because that is the primary or the first interaction with the patient, and equally the other levels of care. And so the challenge is that Kenyans have highlighted the 2.75% taxation, and they have not embraced the universal health coverage. They have not seen its importance in terms of accessible, affordable, quality of care for all, including the vulnerable, the disabled, the widows, among others. And I believe that it is critical for us to ensure that we have robust communication with the community. I think it is important that they own this initiative and they are part of it even during implementation. That way the uptake will be great and we will see many Kenyans achieving this. And from our side, I think it's critical that once we have promised our fellow Kenyans, we need to deliver and ensure that every Kenyan has access to affordable quality care.
Posing.
Thank you, Speaker. Thank you, Speaker. Dr. Barasa, having been nominated for this position, you know that health is generally or greatly devolved. Greatly devolved. And there have been a clamor or a debate outside there that we should have a national commission for doctors or practitioners, health practitioners and so on, and for good reason. And one of the reasons is to balance health practitioners at the county level. Because that is where the biggest problem is, Madam Dr. Barasa. Because of lack of balance of medical or specialized medical people, you find that actually some of these hospitals are running like maybe, I will say, Panadol hospitals. All county hospitals actually run like Panadol hospitals. Because Panadol is just something small to make you at least live till tomorrow. Take an example of North Rift. Turkana County, West Pokot County, Elgeyo Marakwet County, Trans Nzoia County, even Bungoma County. Almost everybody is going to Eldoret for medical services. Why? Because they don't find those services. Maybe because of lack of specialized practitioners. So my two questions. One, will you support the clamor for the constitutional amendment to have this commission to be able to work out on that balancing of medical practitioners so that our people can get medical services at the right places at the county level? Or if that's a long term, what will you do if Parliament approves you, working together with governors, to be able to increase or help that health specialist at the county level so that at least we can have our people at local level receiving medical services? Thank you, Speaker.
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, with the devolution, we've seen a lot of challenges. My approach, again, would be a consultative approach involving the counties, involving the National Technical Working Group, the DG, the PS, and all the stakeholders involved, including partners. And in this case, we need to have these consultations in routine basis to discuss the HR capacity. Additionally, we need to come with the strategies, action plans, including regulations, to ensure that all the counties have the appropriate specialists. And we can monitor the presence and the activities of the specialists using a digital platform, of which I strongly advocate for. I can also say that I am a member of the Eastern Central Southern African College of Physicians. And in this program, I was the initial group of trainers that was trained in Entebbe. And this program was rolled out in Kenya. And we are almost having the first lot graduating, and they're 41 in number. Additionally, there are other specialist training going on for gynecology and obstetrics, as well as surgery. And these are areas that we can engage with the programs and see how to support the various counties so that they can have specialists trained within the facility.
Vicaria.
Thank you, Chair. Sorry. Daktari Debra, Nitauliza kwa Kiswahili. Tuone kama tuta budget kubwa sana ya Ministry ya Health inaenda kwa mambo ya matibabu. Magonjwa yametendeka, tunaenda kutibu na mambo mengine. Kukaja na policy ya kuweka the CHVs, the Community Health Volunteers, ambaye wao watashughulika sana na kujaribu kuzuia kabla pengine, na unajua hawalipwi kwa wakati unaofaa, na zile hela pia wanazopatiwa ni hela kidogo sana. Pengine njia gani utatumika kuona kama wataweza kupata hela zao kwa wakati unaofaa na pengine kuongeza juu kidogo, ndio waweze kusaidia kwa kuzuia kabla haijafika ile ya kutumia hela nyingi ya kwenda ku. Pili, watu wengi wanapata ajali, emergency na mambo mengine, magonjwa ambayo pengine hayaku, ama kama ni accidents za barabara. Wanapoenda katika mahospitali yetu, nisiseme ya counties kwa sababu pengine kwa sababu hiyo iko devolved, lakini katika hospitali za serikali wanakatazwa kuwa admitted ama kuchukuliwa katika ile emergency ya dharura ya haraka kwa sababu hawana pesa za kulipa deposit na mambo mengine. Pengine ni njia gani utachukua kuweza kufanya hali hii isiwe ni kitu cha kurudiwa vile tunavyoona kila wakati? Asante.
Answer.
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, the community health program is critical because it brings health back to the community. And community health workers are a strong pillar in health system strengthening. And so we need to embrace them and support them. Working in Fikiria Jamii, which is which are 17 clinics in the eastern Isili region, the eastern side of Nairobi. It covered Shauri Moyo, Huruma, Madare, Kariobangi, part of Korogosho up to Kayole. We were able to strengthen the community health program. And what we did is ensure that they were bringing mothers for antenatal care, bringing children for immunization, distributing disinfectants, providing preventive promotion care and rehabilitation, because they were part of the community. And the work was marvelous, and I'm happy that the country is embracing the community health program. And so we need to support them, and again, a consultative effort involving the multiple stakeholders so that as a team we can come up with action plans and interventions. Equally, we need to involve other sectors like the Treasury and see if we can have funds to allocate for their support. Additionally, partners are critical as well as the CSOs, so we need to involve partners to collaborate and synergize our efforts in order for us to have the fruitful implementation of community health programs and universal health coverage in general. For the emergencies, again, even as we transition, we need to ensure that they are covered, and we need, even in the UHC program, part of what is covered is emergency conditions. And so I believe that by incorporating this, all Kenyans will be able to access care even in emergent situations.
Honorable Robert Mbui.
Yeah, thank you, Mr. Speaker. Nominee, corruption cases have been a major problem in the health sector. Some time back, there were those clinics that were bought, containers that were being charged at about 10 million a piece, which was highly exorbitant. And recently also we've seen when we had COVID, there were scandals at KEMSA, and there was even a recent scandal under this regime which led to the dismissal of the PS then of health. What will you do to minimize, or if possible, completely eradicate this menace of corruption in that health sector?
Through you, Chair, I would like to address the issue of corruption by honorable member. Again, a consultative effort. It is important that we think strategically, involve the various stakeholders involved, the National Technical Working Group, the PSs and DGs, to understand, to conduct a situational analysis and see where the gaps are. But from my opinion, I think that we need to strengthen the processes and procedures that exist. And one of the ways is through a digital platform. That way, we reduce the human-to-human interface. We can be able to track, say, for instance, how a Pannel from batch 001 gets from the national up to the patient's hand. Yeah, and so we'll be able to ensure that there is a seamless flow. So I am an advocate for the digital platform. Equally, we can involve external bodies to monitor also the challenges that are involved therein, and we can have routine meetings and feedback. Additionally, we need to have accountability and visibility frameworks, and also work together with the various commissions to address the issue of corruption.
Thank you very much, Mr. Speaker. Mr. Speaker, I've listened to the nominees so far, Debra. My name is Owen Bayer. I'm not the honorable member. I hear you talk about situational analysis. I hear you talk, I've counted them, there are 10 now. Digital platform, there are 8 consultations, there are around 7 there. You keep on using the same ones all the time. But the health sector is a big thing, big, very big. And I think it carries one of the biggest budgets in this country. And it has been a Tower of Babel. Okay? There are a lot of conflicting people striking, court cases, a lot of issues. It requires a very high level of leadership. And that high level of leadership is policy. But as I listen to you, I'm not hearing you enunciate or really bring out policy issues apart from consultation. I think the health sector suffers from real strong policies that can drive the sector, so that we have all these issues, these strikes, and everything else really not in place. There's been the question that has been asked on, will you support a health service commission, which everybody else has been talking about. Probably that's the panacea for the problems that we have in health. So Debra, Dr. Debra, my question is, what skills do you bring? Are you able to work with people much easier? There has been a lot of, the PS is saying this, the minister is saying this, the DG is saying this, the CECs in the counties are saying something else, the governors, council of governors is saying something else. How will you amalgamate all these things and bring real leadership in the health sector so that we do not have the problems that have devolved the health sector over the years? I thank you, Honorable Speaker.
Go ahead.
Through you, Honorable Chair, I would like to address the question by the Honorable Member, Mr. Owen. Yes, from a leadership and a management perspective, it's always consultative. It's not a one-man show. The people, the National Technical Working Group, have been there for many years. They understand the situation, they understand the gaps, and they're able to come up with interventions. The thing that we need is to support them, to identify the gaps and come up with improvement plan. And so for me, I believe that it's critical that I give the leadership and bringing the people together to collaborate, to synergize, to harmonize, to improve the services that are being given.
Thank you very much, Mr. Speaker. Dr. Debra, 2 very quick ones. Ministry of Health is one of the most important ministries in the country. It's for the rich and the very poor, it's for everybody. And what is bedeviling people living in the villages is we have small dispensaries which have no drugs because county governments are not able to stock them. And Kenyans are crying over whether really we should have this under the county governments or we should actually revert the entire ministry to the national government. If a law ever came to revert the ministry to the national government, would you, if approved as the CS for health, support it? Number one. Number two, again from the same scenario, everybody goes to a hospital. As soon as God helps you recover, you have no money to settle your bill, and even through a rambas, you have all these problems, and eventually hospitals, including public hospitals, start detaining patients. And the converse of that, sometimes you may die, and the hospital detains the dead body. What policy would you put in place to ensure there is a balance, that you cannot be detained in hospital forever when you've recovered, or you can't have your body if you're there? Your relatives cannot have your body detained forever. At one point, there must be a stop to that. What sort of a policy would you put in place?
And answer?
Through you, Honorable Chair, I would like to address the question by the Honorable Member. Yes, so currently we have a devolved government, but we need to ensure that the supplies and we are monitoring and ensuring that the supplies and services are ongoing in the last mile. And that's why I'm encouraging the digital platform. I have seen it work. I have seen it work in Fikiria Jamii. I've seen it work in Mater Hospital. I have seen it work in the World Health Organization. I have seen us track medicines coming into the port and distributing it across Africa. We can monitor. We can also ensure quality. We can monitor and ensure that the health workers are in the facilities and they are conducting activities as needed. So a digital platform is the way to go. There are many challenges that we face. There are many teething problems that will come. But when we have that, then even the counties can sit in their offices and be rest assured, looking at the quality, tracking on the medications, what is out of stock, etc. So a digital platform is critical. And again, about moving from county to national level, a consultative approach. We need to be strategic, yeah? It's not one man making decision or one woman in this case. I believe that we need to involve the county governments, we need to involve the national team and come up with the best interventions to address this.
Debra, before you go to the next question, please do hand over your documents to the clerk's team so that they can do verification while we are going on. The Honorable Ferdinand. Oh, you have one more question? The retention of dead bodies and recovered patients until money is paid to various hospitals. What will you do? That's what the Honorable Member has asked.
Yes. So strategically thinking, we need to consult and see what are the gaps, what is causing this, and then involve Treasury.
It's money.
Yeah. So I'm coming out of government. So my first agenda will be to review these cases with the national technical team and the county government to identify what is causing or contributing to this challenge. And from there, I believe we'll be able to get interventions.
Ferdinand.
I think it's more or less the same thing, but all I'm saying, Madam, if we are going to be appointed as a CS in health, I think reducing the health care, let's be serious about it. As my colleague just mentioned, it's very, very serious, a crucial item as we members of parliament. Even now as I'm sitting here, there are phones coming from my constituency, please, we have got Harambee. Yeah. But then, of course, you as a PS, you are coming in, should be able to have very strategic plans so that the expensive treatments like cancer, which is, again, coming up every time, should be able to come up with something very, very strategic for us to reduce the cost of treatment and, of course, affordable access to health care. Come up with something that can be able to save these members of parliament in having Harambes every other day, because somebody is going to India. Instead of us, somebody come here, had 2-3 cases where somebody went to India and he died there. So, and everybody now comes to me, how do we get the body here? But more so, this so-called cancer drugs, which is actually is an issue in this country. So come up with a plan. So I see your experience is very wide. So let's hope that you're going to have that kind of plans to be able to assist us in this. Can you say something?
Statement, Daud?
Thank you.
Just take into account the positive statement made by the Honorable Ferdinand.
Thank you, Mr. Chairman. To Dr. Debra, first, NHIF, will you change the system, or whichever it comes, that a patient can only go to one hospital, nominated hospital, and if somebody gets sick anywhere in the country or anywhere, they cannot go to any other hospital but just one? Secondly, I don't know if you answered the same question by my colleague, would you consider that all health workers be moved to a health service commission, just like the TSC? And thirdly, the National Assembly passed my bill of cancer prevention in April. And with that bill, it talks about getting more oncologists trained, and because we've got 40,000 people dying of cancer, it's even higher than even COVID. COVID did not kill as many people as cancer does every year. And what do you think you would have interventions to train more people and have more cancer treatment centers in the country? And the last one is level 4 and level 5s. I'm not talking about dispensaries. Would you think that level 4 and level 5s should come back, like the referral Kenyatta Hospital, to the national government? Because 70% of the funds in the health ministry are held by your ministry, if you are confirmed. So do you think level 4 and level 5 should be taken over by the national government from the counties? Thank you.
3 questions. 1, he says, will level 4, 5s be transferred from the counties to the national government? The second one, about the cancer treatment. And the third one was, will you support, if confirmed, to create the National Health Service Commission? I think there is some doctor somewhere who is sending this message to all of us. I've received it 3 times.
And there's a 4th one, right, Chairman?
Yes.
The 4th one was regarding NHIF.
Yes.
In one hospital, will she change the policy that it should not just be one hospital nominated? They can go anywhere, so long as they've got NHIF. They do not have to go to one hospital.
Actually, that is part of the law you passed recently that is being challenged in court, isn't it? Go ahead and answer.
Through you, Chair, I thank you, Honorable Member, for the questions.
Yes, Nelson?
The purpose of this, if you just told the nominee, is actually so that you can address the members by their names.
Yes.
And this is the committee on appointments, just for information.
Yes. So don't just say honorable member. That one is called Honorable Dawood. Okay,
My humble apologies for that.
Yes.
I will address them by the names.
Go ahead.
Thank you, Honorable Dawood, for the wonderful questions. First of all, I would like to talk about local production of medicines and consumables. I think that Kenya, we need to embrace this. Local production of medicines, the health products, is really one way to reduce the costs of medication. And so it's an area that we need to embrace as Kenyans, and based on the budget, then we can consider strengthening this. In addition, regarding the NHIF, the universal health care looks at offering accessible care, affordable care, and quality of care to all Kenyans, including the vulnerable and those with disability, among others. And so the issue of only being able to be seen in one hospital is not part of the universal health coverage. And hence, I believe that once we have implemented the UHC, first of all, the community health promoters will be able to improve the prevention, promotion, rehabilitative interventions within the community. So even for cancer cases, they'll be educated on preventive measures, and those who are having terminal illnesses, rehabilitation will be ongoing. Equally, strengthening the primary care networks is critical because it's the first contact and it filters the mild cases, ensuring that the severe cases are the only ones going to the other levels of care, and hence there's reduction in the overwhelming of other levels of care. And so I believe that we can have this as accessible, affordable, quality care by strengthening our community health promoters or the community health programs, as well as the primary care networks, and ensuring that we are offering quality care across all levels of care. So regarding the specializations such as in oncology, as discussed earlier, we have the East Central Southern African College of Physicians, which is a program that is running in multiple hospitals within the country, supporting doctors to specialize. We may also consider having this for other specialists, including the nurses, and see how to see how they can grow career-wise as the health workforce, and that way we can also have access to care. For the doctors at the national team, I believe it will be a consultative approach. I cannot make that decision myself. I believe that it's critical that I involve the whole team, the stakeholders, the partners, and other sectors to be able to see how to address this issue.
Point of order, Speaker. Which issue? And I thought if it is about the commission, health, what is your opinion, nominee minister? If you say consultative, what is your opinion as a leader? Do you support, you don't support, even before you do consultation? What is your input? What is your mind? Yeah, yes. you are running away from being personal.
Yes.
We want to get your suitability, you, not a group, but you. Thank you, Speaker.
Go ahead.
So
the question is, if you are confirmed,
yes,
will you support the creation of the National Health Service Commission? There is some doctor somewhere sending this to all of us.
As part,
to ask you.
Thank you, Honorable Chair, and thank you, Honorable Members. As part of the doctors' fraternity, I support the National Health Service Commission. Thank you.
Go ahead, Mary. Eh?
I'll help you to answer.
The level 4 and 5, Honorable Dawood, I believe that is critical.
To refer to the interviewee, even as minister, she has no capacity in law to lift level 4 and 5 from the counties to the national government. It must be a legislation and an agreement between the two levels of government to transfer. So even her opinion here will be relevant. Mary Mase.
Thank you, Chairman. Dr. Debra, I put it to you that for you to be able to realize your policy objectives, you must have adequate or sufficient financing. But when you look at the Ministry of Health, and especially health research, it remains significantly underfunded. And when you look at the budget of the ministry, there's notable dependency on donor funding, especially on research, disease control and management when it comes to control of malaria, HIV, AIDS, name them. My question to you, from your experience in the health space, what are the barriers to achieving optimal funding in health research? Secondly, there are a number of hospitals, if you are approved by Parliament, there are a number of hospitals across the country that have been built through World Bank funding, GOK, and have remained unoperationalized for a number of years. Beautiful structures. Case in point is in my constituency, Amukura. Beautiful structure. They are not been operationalized, no furniture, nothing. So if you are successful, please do an audit of all such hospitals across the country, ensure they have been operationalized so that there's value for money, and before you start building others or advise for others to be put up. I think that the last one, just a comment. Thank you.
Thank you, Honorable Mary, for the wonderful question. I have done a lot of facility assessment, right from the community-based organizations, various facilities at the different levels of care, and also at supporting various countries within the Eastern Southern Africa, as well as the Afro 47 member states supported by WHO. And I'm an advocate for facility assessment. We need to have good capacity, offer quality of care for our patients. And so that will be a top priority for me, to ensure that routine assessment is conducted and that our hospitals are offering quality services. Again, a digital platform would be good to ensure that we are also monitoring and looking at the processes. Yes. So regarding research, indeed, we need to have policies to support research and regulatory. We need to have a regulatory body to look into this. We need to work with the ethics board, among other boards, to ensure that this is aligned. And we have multiple partners who are willing to support in matters research. And so it will be open dialogue, consultation and discussion, and see who can join us to support in the agenda of health research, this being another activity that I wish to undertake.
Thank you, Mr. Speaker. Mr. Speaker, first and foremost, I wish to state that the nominee comes from my county, and especially Saboti. But that will not conflict my assessment of her capacity to serve in that ministry. And I am comfortable from where I sit of her competence, but what I'm worried is that the ministries, especially the Ministry of Health, is a theater of politics. And, you know, the previous minister also hailed from my Saboti constituency, I don't want a brain drain of my sisters coming to Nairobi and being swallowed by the politics of the town. How are we kept in terms of interpersonal relations and the politics that goes around and the cabal of corrupt individuals around the ministries? How will you deal with it? Then secondly, the shift, NHIF transiting to SHA. I think a segment of it is called shift. Is it prudent? Why not revitalize the NHIF in terms of digitalization, prudent utilization of resources, instead of transiting, which means you could also transit corruption? Lastly, Speaker, it is my view that Kenya is ripe to be a medical tourist destination, just like Turkey, just like Malaysia, is a policy on tourism.
The biggest is India.
Yes, thank you. And now being a regional hegemony, you know, we can start with the region, not even beyond Africa, but just as a region. Do you believe that we are ripe to be a medical destination? If so, how? And if not, why?
Nominee.
Thank you, Honorable Member. And indeed, I love your last statement about having Kenya as a tourist destination. Having worked with the World Health Organization, Eastern Southern Africa, that covers the Eastern and Southern Africa region, it's actually based here in Nairobi. It's in the Kenyatta University Teaching and Referral Hospital. It is a regional office. And I have seen the tremendous things that have happened there. We've had expatriates come to stay here with their family, and that has increased. Our Kenyans have been employed through this. Tourism has also expanded, and also some of the products that they buy that are utilized in the office are being bought from Kenya. Equally, as they look into developing infrastructure, most of the time they're using local products. And if they also want to transport these health products, they can consider us. So first of all, I believe that we need to embrace regional partners, not just the country office, the country representatives, but regional partners such as the Africa Union, World Health Organization, among other partners, because they are bringing expertise from abroad, and these are the ones that will strengthen, build capacity, and also mobilize resources. Equally, we need to think about becoming centers of excellence in Kenya. This may not be achieved maybe this time, but it can be a long-term vision so that we capacitate our facilities. A lot has been done in the KU TRRH hospital, among other hospitals, and I think that is the momentum or the way to go in terms of building a capacity and becoming centers of excellence for Africa.
Just to, if you allow me, Honourable Speaker, on the question of medical tourism, yes. You've dealt much on the aspect of expatriates coming into the country. India is one of the countries that receives the most number of patients who go to live there, stay in their hotels, use their... So it's a big beneficiary of medical tourism. Tanzania, across the border here, there's so many people from the coast who go to a hospital that is called Muhimbili or something. And many of them go there, and they benefit a lot in terms of revenue because of patients going out there. Kenya has just been sending away patients. It has not been receiving. In terms of policy framework and legislation, what would you propose if you are given this opportunity to develop Kenya as a medical tourism destination so that we can reap big in terms of our giving out medical services and also in terms of bringing revenue into, in the form of tourism in the country? What policy and legislative frameworks would you propose?
That you combine with Caleb and Mrs. question about medical tourism. Go ahead.
The Speaker, also the transit from NHIF to SHIF or SHA.
Go ahead. Yes, Debra, go ahead.
Okay. Thank you very much, honorable members. The first thing we need to do is assess and look at best practices from the other countries, such as India. What have they done in terms of building their capacity? And how can we improve? What are the timelines? What are the budget costs? In terms of specialists, we need to ensure that we have top-notch specialists in the areas and also expand the medical equipment that can be utilized for this. And again, the infrastructure, the logistics, among other aspects that are involved. And so, yes, it is true that we need to have policies with regards to this. But in terms of how to progress, I think that we need to look at the priorities in Kenya. We don't have affordable, accessible, quality of care for patients. And I'll give an example. When I was in Fikiria Jamii, there was a widowed. She had 3 children. She used to wash clothes in Isili. And this lady had developed complications, and we had to send her to Kenyatta Hospital. And so we had to dig deep into our pockets to get money for her transport and her consultation. Once we did that, she went to Kenyatta Hospital, and an array of investigations, including invasive ones, were requested by the doctor. They could have cost her an arm and a leg. And for treatment, it would cost her life because she could not afford it. So coming back, I think we need to have our priorities right. And that is offering affordable, accessible care to all Kenyans, the vulnerable, the needy, the orphans, the widows, those who are unable to support themselves. And after that, we can think long-term of having Kenya as a medical hub.
Thank you, Honorable Speaker. Dr. Barasa, considering the recent reports of vaccine stockouts and the shift in policy regarding donor-funded programs like those provided through Gavi, the Vaccine Alliance, what are your plans for ensuring sustainable financing and reliable procurement of vaccine and essential health products during your tenure as a Cabinet Secretary for Health? Another thing is about, and I think Honorable Kareb has asked you, it's regarding the transfer from NHIF to SHIF. To tell you the truth, majority of our people, they are not getting it, and they are not even registering. So I would like to hear from you, if you happen to get this chance, what are you going to do about it? Thank you.
Go ahead, nominee.
Thank you for those wonderful questions. And I will start with the last one, transfer from NHIF to SHIF. The service is to the people of Kenya. And so we need to engage them. They need to own it. They need to understand it. We need to embrace and have community feedback, and then work on it to see how we can intervene. And I believe that that was one of the challenges, that the community was not involved. We did not have robust communication with the community. I think it is critical for us to engage the community so that they understand the vision of SHIF And they also contribute to see how this vision can come to fruition. Equally, it's important for us to involve the stakeholders, the counties, the county government, partners, among others, to make this come into fruition. So the dialogue is really critical when we are looking to transfer patients. And then we can come up with appropriate interventions. Regarding vaccine stockout, pooled procurement can be done amongst various countries, say for instance in Eastern African region. And then we can also consider talking to the Treasury and see if resources can be allocated, as well as discussing with partners in terms of supporting in the area of vaccine.
Mishimbogo. Honorable Mishimbogo.
Thank you, Honorable Chairman. Honorable Chairman, my first question, it is on the issue of the program dubbed as Linda Mama. This program used to facilitate free delivery by our expectant mother in this country. But right now it has been faced with quite a number of challenges, making women suffer, especially those who are expectant. I don't know if you're appointed, what mitigation measures are you going to put in place to ensure the Linda Mama program or a replica of Linda Mama program is enshrined so that our women will no longer suffer? My second question, it is about the rising mental health burden in this country, where some studies have shown that in every five people, one is suffering from health disorder. And this has been witnessed in our learning institution, especially in our universities, in our secondary schools, where we have seen love triangles cases, we have seen some suicide cases, some reckless killing, and so many other issues. And this issue is compounded by a fragile mental health system, socioeconomic challenges, and cultural attitudes. Given the existing mental health policies and action plans, what are the key challenges facing the mental health system? If appointed, what policies will you put in place to address these challenges? That is, the immediate, the medium term, and the long term. And also, is the mental health integrated in the UHC? My last question, Honorable Speaker. No, I have the last one. This is last one. The other time I asked only one question, Honorable Chairman. I just want to ask the last question. Kenya right now has a deficit in terms of doctor-to-patient population. Now with the government directives, which frees new employment and term wage bill, what strategy are you going to ensure that we have more health provided, and especially for those dealing with chronic diseases such as cancers, because we have few oncologists. Also in the mental disorders, we have few psychiatrists. What are you going to ensure that at least we have more specialized doctors? Thank you.
You followed 3 questions. Linda Mama, will you bring it back in its same form or another? What do you do with mental patients and mental health care? Okay.
Yes, through you, Honorable Chair, I'd like to address the concerns. I am a beneficiary of Linda Mama, and my daughter is a beneficiary of Linda Mama. And so I'm an advocate of it. And I will ensure that it's incorporated if SHIF is rolled out. Now, during transition, the transition period, at times such activities may, fall through the cracks, but funds have been allocated from the discussions we were having while I was in WHO with the national team. So we need to have a transition plan and or guidelines to ensure that some of these critical covers like the Linda Mama are always there when we are transitioning. So this is an area that we look to and ensure that all mothers and the children are covered. I will combine the mental health and doctors to patient population. Indeed, this is not just the doctors, but the health workforce in general. We need to look at how we can protect them and how they can grow in their career. And so we I will engage the universities and other training programs such as the Eastern Southern College of Physicians, the surgical programs, the obstetrics and gynecology programs, and have deliberations on other programs that we can have in the country for our health workers to progress in their career, because we can have even clinical officers, nurses specializing in mental health, in matters oncology, among others. Equally, it is critical, again, as I said earlier, to strengthen the community health programs and the primary care networks with mental health specialization, or professionals that have been trained in mental health. And so these are areas that we can look into addressing.
Sharia.
Thank you, Chairman. Dr. Debra. KEMSA has been in the public domain for procurement irregularities affecting donor funds. What's your comment on that? And if approved, what policies do you have in mind in safeguarding public resources and the management of KEMSA? Question number 2. Chapter 6 of the Constitution and the Leadership and Integrity Act 2011 imposes the highest standards of trust and integrity for state and public officers. And this is in relation to what my colleague was saying. How do you intend to address the public perception of the Ministry of Health as a mafia house associated with corruption and lack of accountability? What specific strategies will you employ to enhance transparency, restore public trust, and ensure that the ministry operates with the highest level of integrity?
Thank you, Honorable Member, for the wonderful question. And indeed, KEMSA has been in the public domain. What I intend to do, again, is to strengthen the processes and procedures, and that one of the areas is looking at the digital platform, as well as having external bodies conduct routine auditing. Again, visibility and accountability reforms, as well as engaging or a consultative approach to involve other sectors such as ESCC to look into these issues. We need to have transparent tenders, and I will hold my office with high integrity according to the laws.
Yes, Barasa.
Thank you very much, Honorable Speaker. Dr. Debra, a healthy nation is a wealthy nation. And I want to echo my colleagues what they have said. The health docket is a big docket. It's a very serious docket. And also is a docket with a lot of contestation and a lot of conflict. Having said that, almost 4 years ago, we sent many doctors to Cuba. And also Cuban doctors came to Kenya. We never had any feedback. I really want to hear from you what has been that feedback, whether positive or negative, and if there are any positive things, what is it that we have been able to borrow from the Cuban health system? My second question is, you have been a medical registrar at Kenyatta National Hospital. Across the road, you walk to Nairobi Hospital. In Kenyatta National Hospital, you have the largest Kenya Medical Training College in Eastern Central Africa. And also, you have the largest teaching hospital, university that trains doctors. When you compare the two facilities just across the road, in one you are in Europe, and in the other one you are in somewhere in Africa, not even in Nairobi. Just in case this committee is going to approve your nomination, what is it that you are likely to do so that we are able to see a better facility at Kenyatta? Finally, Honorable Speaker, there are memorandums that have been raised by Albert Gitonga, Henry Fundi, and two others about your practice status at the Kenya Medical Practitioners and Dentists Council. What have you got to say about that? Thank you, Honorable Chairman.
So, in terms of the feedback for the Cuban doctors, I have not been to the ministry. I'll be new to the ministry, and this will be a priority agenda. So I will review, and I'll be able to make a report and share with the Parliament. Regarding the training in the Kenyatta National Hospital and how to make our facilities better, routine facility assessments, identifying gaps, and coming up with international interventions to build up capacity is really critical. And I will be an advocate for that and ensure that we are conducting routine assessment. For my practicing license, I am a qualified doctor. My registration is A6275. I have been in clinical practice from 2007 to 2020, compliant to license renewal. In 2020, I joined World Health Organization. It is a UN, part of the UN agencies. It is an international, independent entity with no affiliation to any member states. I was an international civil servant, offering services to 22 countries in Eastern Southern Africa, and the 47 member states also supported in the Afro region. So my work and my capacity was at an international level as a policy advisor, giving strategic direction and technical advice to various countries in the Afro region. Once the President nominated me as Cabinet Secretary, because of the courtesy and respect and coming back into the Kenyan medical environment, as well as the office of the Cabinet Secretary, I renewed my clinical practice.
Mule.
Thank you very much, Chair, and welcome Dr. Barasa to this committee. Chair, I've pursued and I've looked at the CV of the Dr. Barasa. Having worked at Kenyatta Hospital as a registrar, Mata Hospital as a promotion, worked at Eastern Dinari as a physician and promoter, and then straight to WHO. I have no doubt on your experience, but I have a serious concern of where you are coming from and where you are getting into. And I think Kosin alluded to that. We want to hear you, how you will transit. Having been in the medical fraternity for the last 20 years, where you are coming from is where things are done as the policy of the institution. You are joining government whereby complex, low interest politics carries the day. Madam, with all due respect, I believe you are getting into the Ministry of Health, whereby we have several departments, starting with the doctors themselves, starting with the nurses, the procurement agency, KEMSA, the programs, everything. I want to hear from you your management skill, or now you'll transit from that set mind of a straight line of thinking, and no wonder you are telling us every time consultation. Here, it is whereby the law applies. The law which is applied at KEMSA is not the same law which is applying with the doctors, enumeration and hiring. So, my question starts with, how do you tell Kenyans you'll streamline supply and demand of health communities in this country to the grassroots level, putting in mind we still have a devolved government? Secondly, from the international community where you are coming from, there are those policies and guidelines which are being given to this country we must adhere to. One, Honorable Mukami talked about Gavi and vaccines. You know very well Gavi has been supporting this country for many years to provide vaccines and other commodities. But as a government, we have always delayed to pay these supplies, yet endangering the young newborns and the future of this nation by not being vaccinated and exposing them to diseases like polio. What is your take to how to progress on that? Thirdly, as a country, we are binded by all international commitments, starting with the United Nations Convention on on health policies. And I want to hear from you, how do we get out from donor-funded health programs in this country to a government-funded programs in this country on TB drugs, TB diagnostic tools, HIV drugs, HIV diagnostic tools, vaccinations and distribution of vaccinations to the country, malaria drugs and malaria transmission diagnostic tool. And last, how do you coerce the seamless working relationship between the Ministry of Health and the county government, putting in mind the largest budget within the ministry remains at the national government, and what is required to be transferred to the county government, it is transferred. And lastly, what policy are you going to use on relationship on working with the county government and the CECs at the county level to ensure that Kenyans does not suffer anymore for lack of health services in this country? Thank you.
Quite a mouthful. Can you answer that?
Thank you, Honorable Member.
Honorable Mule.
Honorable Mule, my sincere apologies for that. And indeed, I sense a lot of passion in matters health. And if hopefully given the opportunity, I believe we'll work together to address some of these pertinent issues. Yes, so again, this will be a priority in my agenda to understand the situation and come back with interventions, seeing that I will be new to the ministry. So the issue of supply and demand, again, we need to strengthen the information system. I think my mind has been focusing on that because I have seen it work. I have seen it work in various organizations that I have worked in. I have seen it being rolled out. I've seen the teething effects, but I have seen the impact it has had. It has reduced on costs, it has improved quality, and it has enabled people to track and see where their stockouts, among others. So we can be able to track the supply of commodities up to the last mile. Yeah? And then we can be able to also monitor other services. So I am an advocate of the digital platform because the human-to-human interface is what is bringing challenges, I believe, in our country at the moment, among other things. So for the vaccines and commodity delivery, yes, we need to allocate budgets to support this, and then we can have pooled procurement of vaccines. We'll also deliberate with the vaccine programs that are currently here, the vaccine production, and see on their effectiveness and their efficiency, and the cost implication. So, coming from my background, I know the concerns, the teething effects of vaccine production, and I know the members, the nominated committee wanted me to talk about vaccine production, but I think it is important that we go in depth and identify all these things before making commitment. In terms of health policy, for the dwindling donor funds, one of the areas we can consider is health insurance, but again, we need to have community ownership. The community need to embrace it because, you know, there are taxes involved. So we'll need to educate them and make them embrace it. With your support, with the county government support, the stakeholders, the partners, I believe we can make this successful. And equally, there are some programs which are again feeding into the universal health coverage, including maternal to child health programs, the TB programs, and so on. So we can see how to work as a team and synergize our efforts for improvement of services in Kenya.
As we sit here, the Kenyans who are watching, and they have been sending some SMSs to almost all of us. A few of them, they say, in case you are approved, embrace biotechnology and diagnosis, harmonize salaries of health workers. They earn different salaries while doing the same job. Somebody else says there's a program called Edu Afia for students. It was suspended because of fraud instead of punishing the fraud. Another one says advise her to solve UHC staff menace. They get only half salary for full work. Another one says Linda Mama must come back. That's what Mishi was saying. Another one says ensure SHIF covers ICU costs which are unaffordable by all Kenyans. Another one says, how will you handle monkeypox disease if you are confirmed? And you had answered that. Yes. Yes, Mule.
Chair, I didn't hear touch on the issue of diagnostic tools as recommended by the UN on the TB, HIV, and also supply of vaccines and drugs for malaria and the diagnostic tools for malaria, please.
Yes, go ahead.
Yes.
The ones I've given here are just comments extracted from SMSs. Can you answer the members?
Thank you, Honorable Muli, for the question, and through you, Honorable Chair. Yes, this is an agenda that will also be priority in my list to be able to identify the situation and the gaps and the interventions therein. Regarding monkeypox, I'm happy to say that within this year, we've had multiple countries within the Afro region that have had monkeypox. And I have been part of the team that has been supporting the countries. And so I believe that this, with the support from the National Technical Working Group, we will be up to task to support the country to address monkeypox in terms of readiness and response in Kenya.
Daud, what was it?
Thank you, Mr. Speaker. I want to follow up what my colleague, Honorable Imase Mary, asked about facilities which have not been opened. A case in point would be even Meru, where there is a 5-story building which was done by Honorable Kiraito. He was the governor. 3 years down the road, it's never been opened, and there is congestion in Meru level 5. So there are many places like those. do you think once you get in, you will say it is not national government, it is county government? What would your position be on those unopened facilities?
Take also from the Deputy Speaker.
Dr. Debra, also some concerns that have been raised by members of the public who've sent me messages. They are saying that the community health promoters are being paid timely from the national government, but the contribution of the county governments comes in very late. I think they've been said that Isiolo County, they are currently on strike because they have not been paid. Nyamira County have not been paid for 9 months. So how will you ensure that the county governments are also able to make their payments as government does, national government does its contributions?
Thank you very much, Speaker. Dr. Debra, just 2 quick questions. One, there has been worry of staff of NHIF transitioning to SHA or SHIF. They are worried about losing jobs. We have a law that is in place, but they're worried. What is your take on this? Are you going to transit all of them? Are you going to ensure all of them have jobs or others will lose jobs? This is a concern of NHIF staff. How do you respond to them? And secondly, what legislative proposals do you have to strengthen the health sector as you take over, if approved by this committee? Do you have any legislative proposal you want to make here? Because these are legislators and they will support your agenda. Do you have any legislative proposals going forward so that we can strengthen the health sector? Or what gaps are there in the law that you may want to fix to make health a better sector?
Thank you very much, Honorable Owen, and for the questions that have been raised. So I will start with Honorable Dawood's question regarding facilities and their capacity. It is critical for us to monitor the capacity of healthcare facilities to ensure that they are up and running and they are offering quality services. And so it is critical that we conduct routine assessment to identify gaps and come up with intervention. I hope to work together with the county government in terms of identifying the gaps and supporting, because healthcare, the health system is not just the infrastructure itself. It is the commodities, it is the services, it's the human resource. So we need to look at all those things and ensure that our healthcare facilities are up and running. And that is a task that I would wish to take up and in consultation with the counties. Again, the community health promoters, indeed, they are a critical component and a pillar for health service delivery. They are the ones who go to the community, supporting preventive, promotive, and rehabilitative activities. And so discussions with the county government on the gaps as to why they are not, the community health promoters are not receiving their money is really important, and it will again be part of my agenda. Regarding the NHIF, I'm still new to the ministry. I will need to review the HR capacity, the number of human resource that is required for the new insurance, but an intervention can be to match and move the HR, depending on their roles and responsibility, to the new area. So again, this is an agenda that we can have with the technocrats to see where the gaps are and how we can move the NHIF, because it is very sad when, you know, the sole provider of a family loses their job. And so this is something that we need to support our NHIF staff.
Saying that the law that was actually passed in Parliament on the social health insurance and social health authority says that they will all be assessed And if you have the skill set for the new system, you will be taken. So there is no guarantee. Don't set yourself up. When you get there, you'll get into trouble that you promise you'll hire them. They will be all reassessed. And if they are suitable, yes. If they are not, they will not be taken. Because it was said that in NHIF, there are some people even who are geologists, and yet they're working there, or nuclear scientists. So their skills don't match the work that they're doing.
Thank you, Honorable Chairman.
You will be the last.
Honorable Chairman, Kenyans have really been crying on the issue of public participation, and that there's so many decisions made in terms of Ministry of Health without their knowledge. My question to the nominee is, are you conversant with Article 232 of the Constitution on the values and principle of public service, and to what extent does your personal and work experience reflect these principles? I thank you, Honorable Chairman.
Yes, Majority Leader.
Thank you, Chairperson, Chairman.
Yes.
My last one, CS nominee. To me, you come across as a very young, diligent professional, but I have doubts in my mind. Will you be able to manage the cartels in Afia House? Because the home of cartels is Afia House. It was Christian Mafia House some time back. Do you have what it takes to fight the corruption cartels in Afia House, in NHIF, the cartels in KEMSA? Do you have what it takes?
Go ahead and answer.
Mr. Speaker.
Yes.
I think we also need to be fair to our time and the nominee. That question has been asked several times, so we can't keep on repeating the same. So I think honorable members must be attentive.
Speaker.
Yes.
Speaker.
Yes.
The question of the mafias and corruption was asked, but I think to be fair to the majority leader, he's asked about what he thinks in terms of demeanor. I think it is just more in her direct strategy. And even as you respond to that, I would tell you that the mafias always also say, we have seen many come and go, including the most recent one. So I think as much as that question has been asked, she can respond to it.
Isula is taking over my job.
Women power.
Let's take Raso. Let's not do another round. Raso, just you'll be the last. And the question being asked is very pertinent. It was asked before, as Amisi said, in fact, 2-3 times. Do you have the capacity, the ability, the will, and the strength to fight and resist the mafia at Afia House? That is the question.
To have thick skin.
Thank you very much, Honorable Chairman. Dr. maybe mine is just one quick question. You have worked at WHO, and there's prescribed number of doctors per patient within a population. What is the standard, and how far are we as Kenyans? Because the UN says 1 policeman to 400 Kenyans. What do they say in terms of doctors, both at the national and the county level per population? Thank you, Honorable Chairman.
Thank you, honorable members, for the questions. With regards to public participation, yes, this is a very pertinent issue of which I am passionate about. I believe there is need for community ownership. And what I see is that the highlight is the taxation of 2.75. We are not talking about accessible, affordable quality of care for all Kenyans, including the vulnerable and the ones with disability. So there's need for robust communication. We need to strengthen communication to the community so that they embrace and they own this initiative. We need to gather feedback and see how we can address the challenges. We need to look at the misinformation and counter it. We need to engage the community. And one of the people in the community that we can use are the community health promoters. And so I think that, or I believe that the risk communication, community engagement, addressing all these things is really a critical highlight before embarking on this journey. Regarding being able to manage the mafias.
You can't manage them, you confront them. That is what you have been asked. You eliminate them.
So, Honorable Chair.
Your colleague who came earlier said you neutralize them.
First of all, we can look at prevention than treatment. And one of the areas is the early warning indicators. We can use a digital platform, yeah? We can use, open tenders or transparent tenders. And we can use independent bodies to monitor this. And engaging the EACC and other bodies in this.
Go ahead.
In the discussion. So I think we need to strengthen.
You have the courage and the will, that is the question,
yes,
to confront the mafia,
yes,
and defeat them.
I will hold my office with high professionalism, yes, and high integrity.
Good.
But here she can't manage and treat mafia. She has to deal with them head on. She has said that she's going to manage and treat. We can't deal with mafia as like that.
I think she's understood. You can't treat the mafia, you fight them. They are a criminal enterprise. And exactly.
I think the Honorable Mukami did not get the nominee right. She said there can be preventative treatment, and my understanding was that preventative in terms of preventing corruption, if I got her right. And what she was talking about, curative, I think is what she was now explaining in terms of working with other agencies. It's only that she's a doctor, she's using medical parlance.
Okay. The last question from Raso. What, from your UN perspective, is the doctor-patient ratio in an average society like Kenya?
No, we are not quite there, but we are doing well compared to other countries in Africa. So we need to look at improving the HR capacity, not only for doctors, but other cadres such as the nurses. Yes.
What are the numbers?
The ratio. What's the ratio?
I will have to confirm the ratios. Yes.
Yes. Okay. Now, a few formal questions. Other members, a few formal questions. Do you hold any leadership position in any political party?
No.
Have you ever been adversely mentioned in any integrity-related report or investigation?
No, Honorable Chair.
What is your net worth in terms of wealth?
Okay. So my net worth is a combination of mine and my husband, and it's 455,845,320.
You and your husband?
Yes.
Honorable members,
That is Mr. Speaker.
Yes?
That's the Speaker. Mr. Speaker.
I think because
yes, Caleb.
Yeah, because this is a House of Records, so I propose you divide into two.
Chairman, it is not necessary to be divided into two. It can be another way.
Don't break families.
Yeah.
If they own it jointly, if there's a dispute, the courts will decide.
845,845,320.
Yes.
Okay. Millions.
Yeah.
Yes. Honorable members, the nominee, according to the clerk, has submitted her papers and are all in order. 7 memoranda were received from various people, and in her written response, she answered all of them. You are now released. Yes? Yes. You are now released to go back with your original documents, which will be given to you by the sergeant behind you. And have a good day.
Thank you. I'd like to again thank His Excellency the President for nominating me as Cabinet Secretary, Minister of Health, and also for the nominated committee for giving me the opportunity.
Appointments Committee.
The
Appointments Committee.
Appointment Committee for giving me this opportunity to also present myself, and I am happy to bring my expertise and serve the people of Kenya.
Good. Bring the next nominee. Members, do you want to break and resume at 2? How many minutes?
5.
10 minutes. Lunch is served in the boardroom of the commission. Those of you who are hungry.
Just eaten a snack.
Yes.
5, yeah.
10 minutes. We'll do lunch after the next nominee.
Wireless. 1, 2. Ongeza sauti.
Uliendaje? Ukifika hapa naona vile mmenileta. Shida hii akisimama sauti tashinda. Shida ya kuinua hii. Daktari, mambo hii kitu hii sasa kenye tunaweza fanya
ikikuja tu
tunaweza ongeza hii iende juu kabisa, lakini si unanisikia hata nikiongea.
Hebu ona. No. Ona kulingana na nominee, unaona balance inafaa ikuwe hivi. No. I thought mimi anasaidiwa kushika hivi. Ukileta hapa juu the weight comes here. Unaona inainama. So ikikuwa hapa in fact hata yasishike. Akishikiwa hivi. Unaona iko sawa. Ikiguzwa tu pia kushikiwa.
Hiyo kishikwa ndio tunapoenda.
ukiwa na screwdriver ni kukaza hapa. Unajua ni kitu kukaza.
Inafaa kukazwa, but hatuna nini? But in terms of signal, iko fine. Kim. 1 2 mic testing 1 2. Unaona signal yake iko sawa. Iko sawa. Kim. Nashika. Iko sawa.
Ile maji yetu hapo. Mimi niko na screwdriver, ni vile iko
nimeshika.
Nikipita nitachukua tena tunachukua.
Iko stable. One, two. Iko sawa.
Sasa hii unasema itakaa tu hivyo vile.
After juu unaona hii ni fupi na nomini mwingine anasimama na ni mrefu na hii hatuwezi inua. So iko sawa. Wakimaliza kuzima na kuweka kando. Sasa baba. Sawa.
Debra.
Numbers, so that we get their IDs and their KRA.